So the Lurch gait pattern associated with the gluteus maximus problem is characterized by a distinct movement pattern during walking where the individual tends to throw their hips backwards excessively. The gluteus maximus, being a major muscle responsible for hip extension and stabilization, plays a crucial role in maintaining proper posture and controlling the gait cycle. When there's a dysfunction or weakness in the gluteus maximus, it can lead to compensatory movements, resulting in the lurch gait. In a typical walking cycle, the gluteus maximus engages during the stance phase, when the foot is in contact with the ground. Its functions to extend the hip joint, providing stability and propelling the body forward during the push-off phase. So let's look at the lurch gait characteristics. So excessive hip throwing. So an individual with a gluteus maximus problem exhibits an exaggerated backward movement of the hips during walking. This throwing motion is often more pronounced during the push-off phase of the gait cycle. Hip extension deficiency. So the gluteus maximus weakness results in a deficiency in hip extension. As a compensatory mechanism, the individual attempts to achieve hip extension by leaning backwards, leading to the characteristic lurching movement. Reduce forward propulsion. Since the gluteus maximus is responsible for propelling the body forward, its weaknesses can lead to a noticeable reduction in forward propulsion. The lurching gait becomes a way for the body to generate some form of momentum. Altered kinematics. The entire gait pattern is altered due to the gluteus maximus dysfunction. The body attempts to find alternative strategies to maintain balance and forward movement, resulting in an abnormal, inefficient walking pattern. So what are the causes of a lurch gait? So the first one is gluteus maximus weakness. Underlying factors such as muscle imbalances, injury, or neuromuscular conditions can contribute to the weakness in the gluteus maximus. Compensatory mechanisms. So the lurching motion is a compensatory mechanism employed by the body to overcome the deficiency in hip extension caused by gluteus maximus weakness. So what are the clinical implications? There's an increased stress on lower back. So excessive backward movement can place increased stress on the lower back, potentially contributing to lower back pain or discomfort. Reduced efficiency. So the lurch gait is less energy efficient and can lead to increased fatigue during walking, running, or playing sport. Risk of falls. So altered gait patterns are associated with an increased risk of falls, especially in the older population. So what is the treatment approach? Strength training. So certain exercises targeting the gluteus maximus to improve strength and function. Gait training. So rehabilitation programs focusing on correcting gait patterns and restoring normal hip mechanics. And biomechanical assessment, so identifying and addressing any underlying biomechanical issues contributing to gluteus maximus weakness. So the lurch gait associated with the gluteus maximus problem highlights the importance of muscles and their impact on functional movement. Identifying and addressing these issues through targeted interventions can significantly improve gait mechanics and overall mobility.